Hi, welcome to this video. My name is Dr. Neher Sinam, and this is applicable for medical students as well as for non-medicals who go to hospitals as patients. So I would like to tell that whenever there's a contact between a doctor and a patient, we take something known as the history of the patient. History is about getting to know the information about the patient, and then we do an examination of the patient to see in a medical clinical way to see what problem he or she is having. So the first part of this history is particulars of the patient. That is how we start. And then we will ask what problems do you have. Those are the chief complaints and history of present illness. Then we'll ask about any illnesses in the past, history of past illness, personal history like your smoking habits, sleeping habits, eating habits, and any drug allergy, family history, any problems in the family like communicable diseases or cancer and things like that. Then we do a general examination of the patient, and then we go to the particular examination of whatever that patient is complaining. So when a patient goes to a doctor, we can either do a very formal history taking where we'll ask what's your name, what's your age, what's your gender, what's your address, what's your relation, or it can be very informal way, like when I talk to a patient, in between the stuff that we talk about, I sort of find out what all these data, and it's a mixed up way of it's a very non-systematic way of taking the history or doing the examination, but then that comes with experience. But if you go to a hospital or if you're a medical student, let's say a doctor meets a patient, first thing we want to know is the name of the patient. Firstly, that my name is Neher Sinha, I go as a patient. The doctor wants to identify me. He wants to call in, Neher, come here, Neher, do this, Neher, can you please do that? So one is for communication with the patient, and by using his name instead of using bed number one, come here, Neher, come here, can you please do this? So like that, it develops a good rapport between the doctor and the patient. And apart from that, other doctor, when I tell the nursing staff or other doctors, we have to do this for Neher, like that. So they can, the name is used for identification and rapport formation. Will my name have any bearing in my treatment or diagnosis? If my name was Neher or if my name was James, will my treatment be different? Probably no. It should be no, but if it happens, then that's discrimination. Next is age. My age is 30 years right now, almost 31. And then if I was 10 years old and I go with chest pain, the doctor is not going to think about heart attack. And if I was 75 years old and I go to the hospital with a complaint of chest pain, the first thing they might think about is heart attack, and they have to they have to assess whether I have heart attack or not. And for children, we'll probably think about heart attack and all later on. Apart from that, if there were two Nehers of 5-year-old and 30-year-old, then again age is important for identification of the patient. And some diseases are more common in the childhood or exclusively occur in the childhood, and some occur only in the adults or elderly, and some are more common in the elderly. And for females, there's a certain reproductive age group like 14 years to 50 years approximately. And if someone falls in that period and they come with certain complaints, we have to think about reproductive organs problems. And otherwise, in a 2-year-old or 90-year-old female, you're not going to think about those things. Gender, male or female. Okay, so there can be a person with a particular name ABC, two of them called ABC of age 20 years. One can be male, one can be female. So again, gender is used for identification of the patient. Apart from that, some diseases are more common in males and some occur exclusively in males, whereas some occur exclusively in females or more commonly in females, like problems of the uterus, ovaries, and those things will occur only in the female. Breast cancer are more common in the female. They can occur in the males also, but are more common in the female. Next is address. Now, address is a bearing in It's also for identification again. And Neher from India, Neher from England, like that, no? So, but if someone Neher who lives in the urban area, Neher who lives in the hilly places in the cold, or who lives near the ocean, so we can have different diseases according to our place of habitat, and some diseases or communicable diseases can be more common in certain areas on this planet, and in certain states, in certain cities. Some communicable diseases like COVID at a particular point of time, and tuberculosis, calars, or HIV, and thyroid disorders are more common in some places. Like that, address is important. Then religion. For religion, though, some of the examples I can give is that Muslim children, they get circumcised. That is, their foreskin is cut during their childhood, and that is known to be protective against. Protective does not mean totally prevented. It is chances of that person having penile cancer is quite low compared to the general population who don't get their penis circumscribed and circumcised, not circumscribed, circumcised, circumcision. And then, from my personal experience, I'm seeing that Muslim patients in India, they do fasting around the months of May, June, or July, somewhere around that. So at that time, if a patient comes with severe abdominal pain and he or she is a Muslim, I will first think of perforation, because they don't eat, they do fasting and they don't eat for long periods of time, and that makes them prone to having a gastric or intestinal perforation because of the acid over there. And then eating habits. There's a tapeworm found in pork, and I would not think about that in a Muslim patient. It can be a Muslim patient can eat pork, but then I'm not saying, but I'll think less about it, and later on, and I'll try to rule out other things first. So those are some examples of habits and what they do or what they do not do, etc. Like Muslims don't drink alcohol, so we'll think about alcohol-related problems later on, and not right away. And then occupation. A person who's an athlete, a doctor, unemployed, a guard, or an office worker who has a sedentary life, they all will have different health issues. Like an athlete can have bone or joint problems or some muscular pain. Someone who has a sedentary lifestyle can have high cholesterol levels, more chances of heart attack and stroke and all that. A person who is a guard or a bus conductor or a surgeon who stands for long periods of time, they can have varicose veins, and that way occupation has a bearing on how we can get an idea of how educated this person is. I'm not saying that someone who is a doctor is more educated than someone who's not unemployed, and the unemployed person can be obviously smarter. So let's not do have any debate about all that over here in my comments. But then I'm seeing it, a higher probability of a doctor understanding, taking your advice, and let's say there's a sports person who fixing a fracture for an athlete is much more important, or is of much more value than other people. Fixing the nerves in the hands and tendons in the hands are much more important for surgeons than and for musicians as compared to other people. So occupation plays a role in how important that treatment is for the patient, and what diseases or what problems might be more common in these people, and whether they will follow your advice or not. You can have a rough idea with this occupation. And then date of admission and examination. Let's say I go to a conference next year in United States of America, and then I'm presenting this particular case that I've taken a history of and examined and treated, and I'm presenting it in January 2022, and I say, there was a patient, this who came to my hospital on the 15th of August 2021. So I need that date of admission, when this patient was admitted in my ward. Otherwise, if I just say there was a patient who came with a headache for 7 days, they might not know whether that headache was in September, August, or April 1994, right? So we need this date of admission and date of examination, because patient may be admitted on 10th of August. I'm examining on 15th of August. So when I say patient has a complaint of headache for 7 days, we have to mention 7 days prior to the date of admission, or 7 days prior to the date of examination, 10 and 15th August. So if I say 7 days prior to the date of examination, that means 2 days prior to the date of admission, the patient came in 2 days after having developed his symptoms. So like that, we have to take these particulars of the patient, and all this happens in like less than a minute, and then we move on to the actual history of the patient, that is the complaints and the detailed history about those complaints. Yeah, so I hope you like this video, and don't forget to subscribe to my channel. Click on that like button, click on it. Yeah, and see you in the next one.